Шановні колеги, ми продовжуємо робочий день. Нашим гостем є
We continue our working day. Our guest is Oleksandr Linchevskyi, Deputy Minister of Healthcare of Ukraine. Topic: emergency Medicare reform in Ukraine and improvement of medical standards and clinical protocols. Welcome on stage. Good afternoon. Nothing really happened. This is weekly discussion with the representatives of the Ministry of Healthcare, and I am here, and maybe we will have weekly gatherings in order to have good communication. So there is no sensation. We are just telling you about the work done by the ministry. So we will start with what is going on when the patient comes to the doctor, and or about emergency help. Now emergency service is one of the most important mechanisms in the system. No matter what anyone say about some terrible situations, some people criticize ambulance, but it really comes at sight and helps. So our attention to the service is connected not because this is the weakest link. This is really a cornerstone of the system that we really need in our work, and we would like to improve the quality of services. So we can rely on the service, several simple steps or things we would like to focus attention of the public and community. First, we are working on the development and introduction of courses of help for police officers and firefighters. We concluded agreements with the proper ministries, and the program is developed. We have to adopt it and implement it into life to carry out trainings. Why it is of importance? In an emergency situation, and death because of trauma is listed in top 5 of the cases of death, and police officers come first. That's why first manipulations are important in the first minutes. So we should do maximum. That's why our police officers and our firefighters should be properly trained in order to provide help, and they should provide emergency medical assistance to people. And now they have only formal knowledge, and we would like to improve their skills. And then dispatcher system, we are trying to make our emergency help more efficient. And in the world and in Ukraine, there are dispatcher systems that help to track on the map the movement of ambulances and direct them to the site, and that not the ambulance from one region to the next. We have the technology to send the ambulance that is the closest to the site, and this allows to bring doctors faster to the patients. And also we would like to select out those calls that are not related to emergency services. So some cases should be dealt with by pediatricians at the polyclinics, and in some cases it can be useful to create a call center, and people can be consulted by phone, and this will reduce the load on the service. And fourth, to broaden the network of substations. And we are surprised when we hear from the media that they say that some services are reduced. You know that Toronto and Kiev are the same as, in terms of population and area, but in Toronto they have a similar condition, but the number of substations is 3 times more than in Kiev. Dear patients and colleagues, we deserve faster coming of the ambulance, and if for this we need to improve and to simplify the work of ambulance, we should do it. If we should increase the number of ambulances, we should do it. And of course, the priority in our work, we will pay more attention to training and to increase the level of professionalism, not only of the ambulance, but other specialists as well. So also doctors and nurses will be trained in order to provide efficient assistance, to improve the work of ambulance, to bring it up to the level of Germany, France, or Canada. And also the standards of help. We believe that pain in the chest or in stomach or any emergency situation in the United States and in Ukraine, it should be treated similar. So if the help is provided in other ways, so we should bring our help up to the world standards. There will be standards developed that will meet European standards and American standards, and we will pay more attention to training. There are programs or curriculums for paramedics. These are 4-year programs and curricula for ambulance personnel, and also refresher training for those who work. And also one more step is the creation of emergency rooms at hospitals. We are speaking about the necessity to create a department where 24/7 yearly there should be proper medical assistance, and if the patient addresses, no matter what, there will be a person who will wait, and this doctor will have the necessary laboratory and other means, and this doctor will be able to provide assistance. So people will know where to address to. These centers where this help will be provided, they will be named, and there are central hospitals where these centers are going to be created, and they will be working 24/7. And these changes are not new; they are in the law, and it was adopted. And these changes are really important for patients. They will simplify the work of medical personnel. That's why we will pay attention to these issues. And the main is, and it is usually left aside, these changes, these reforms, they are not implemented in the ministry. They are implemented by our colleagues, by doctors, by chief doctors in every hospital, every substation, and of course we will try to help them in their work, and if there should be understanding at local level, and if people at a grassroots level understand the necessity of these changes, they will do this at hospitals and substations. These changes are they implement these changes now, and without the support of the doctors and the community, we will be helpless. That's why every change depends on medical personnel, on individuals. And the last thing, we will speak about evidence-based medicine, and this was introduced in the 1990s when we are speaking about scientifically based medical practice, when the way of treatment and diagnosis is based not on individual experience of the doctor intuition, but based on international experience, big numbers of patients treated, and that is the best practice, and we will pay attention to this. Thank you very much. I am ready for questions.
Now let's move to questions. Please introduce yourself. Ukrainian Association of Advisors on Management. You were talking just about the city and region. The ambulance in cities is operating well, but what about villages? Are you considering all these issues? And then in Soviet times, the traffic police were taught how to render first aid. Now, what's done with our patrol police? Thank you for questions. As to the police, patrol police, traffic police, there is the cooperation. It's very adequate. We have meetings with the leadership every day. The police requests about that. In Kiev police had such training. That was done by some civil society organizations, but we are happy that that's happening. As to rendering assistance in rural areas, we do have problems here, and you all know about them. It's more about roads. There are many calls which are this emergency medicine is basically supported by the medicine is supported by ambulance. The ambulance goes even if they shouldn't go there. Maybe some elderly lady just has a high blood pressure. But we are trying to move to the situation when the family doctor will go and visit that elderly woman, and the ambulance will not have such a big load of work. The roads. You can do nothing. The roads are awful, and we need to to talk about that. We need to tell about that. When we are talking about bad Ukrainian roads, we're not talking about traveling in comfort, but the patients suffer most. There are some technical issues which are not very obvious. This van which can go anywhere, but the conditions of transporting the patient in it is not adequate. They are empty. There is no additional equipment there. As to new vans, ambulance vans, they look great in the city, but they cannot reach every village and every house. These problems do exist. Every community knows about that those problems better than we do. Maybe I missed some part of your question. It's not because I don't want to answer some question. Please repeat if I missed something. The next question. Factor ICTV. I have several questions, one by one. Antibiotics resistance, is that the problem today? And how can the ministry influence it? Can you introduce the sale of antibiotics by recipes only? When the antibiotics are sold without recipes, well, this is a problem. Can the ministry somehow influence this situation? You probably know about tomorrow's roundtable on antibiotics resistance. I've heard that it was shifted to the notes tomorrow. Antibiotics resistance is a very narrow topic. When we're talking globally about ambulance that cannot reach a person on time, and the person has to wait for half an hour instead of 4 or 8 minutes, the question, the issue of resistance to antibiotics is of different scale, but I agree. Overprescription of antibiotics is very characteristic for us, and there are many reasons to that. It's not that they are sold without recipes. Yes, we would like all the medicines to be sold only when recipe is presented. I don't think that the reason for resistance to antibiotics is that they are sold without recipes. The modes of using antibiotics are not optimal. The doctors do not always follow the rules of rational antibiotic therapy. And that's the issue of their education. And there are some unexpected reasons why they prescribe antibiotics. I don't know whether this... Maybe you will stay later and I will explain it to you in detail. But yes, the free sale of antibiotics will... if the antibiotics are sold only for recipes, then the situation will improve. And then the second question on the medicines for oncology patients. especially painkillers. Do we have enough of them? Because we receive information that there's a big deficit of them, shortage. Sometimes I believe that I'm repeating myself again. Till now, the problem is, I don't know whether you know about that, but the problem is there are non-injection forms of narcotic painkillers, morphine in syrup and powder in pills. They are good for use for patients who are basically dying. For that, the paramedics brigade shouldn't be coming and make injection like it was in Soviet time.
And the patient can take the medicine when he is or she is in pain. So plaster, syrup, or pill, these forms were not implemented in Ukraine before that because they were not registered. As of today, we have morphine in pills. The producer says that this is humanitarian initiative. They are ready to register and to produce these medicines in sachet. And from our side, we initiate registration and buying of these medicines in syrups for children who are dying. They this syrup can be implemented, and it doesn't need a doctor, and these medicines, they were not registered and they were not available. As to their registration and use, we have several key problems. I would say that the patients do not know about this opportunity, and the doctors do not know about it, and they do not tell the patients. And there's no clear statistics on the patients, adults and children, how many of them need this pills, and we do not have the mechanisms to track this. And we know the recommendations of the World Health Organization, who provide recommendations on the palliative treatment of the patients who are dying, and we have only approximate orientation, and we started the process of registration, buying and bringing these medicines in syrup. We carried out negotiations with the producers in Ukraine to establish production of these medicines, and some batch of these products will be supplied soon. So these. So this is official statistics, but the mechanism of official statistics that was before us, when the ministry calls and asks how many children do you have that that are provided with palliative treatment, and they say, for example, that there is one child per oblast. That is not true, but this is a rough statistic, and this diagnosis, the status is not always recorded. For example, they say that a child is dying from some tumor, but this information is not provided to official statistics, and according to outdated statistical forms, we say that these are 197 children. According to World Health Organization, there can be 17,000 of such children in Ukraine. So we do not have clear mechanism how to calculate this. Please be brief. We have time for 2 questions. Please introduce yourself first. Interfax Ukraine, I have a question about protocols and standards of treatment. We hear from doctors that they follow the protocol, and they say that they do what is in protocol. And we hear from pharmaceuticals that we do not have protocols in Ukraine. That's why our medical care cannot develop, because they do not know what amount and what products to produce. So do we have protocols in Ukraine, and how to force doctors to adhere to these protocols?
In fact, the protocol is a very good thing. We do have them, they are developed, they implemented. How much they correspond to the modern evidence-based medicine, this is another question. But the protocol is in simplified form. It's guidance for a doctor, which says what the doctor should do with the patient mandatory and what is desirable. And there is a clear list of examination and treatment, 1, 2, 3, 4, that's mandatory, that's desirable. On the other hand, we can demand that the doctor adheres to the protocol if we approve this protocol. And then we advance the quality of rendering assistance. But that is also good for financial calculations. We say that every patient who comes for assistance and it has a high temperature has to have the temperature measured, and so on and so on. It will be easy to calculate the guaranteed volume of assistance, which will be covered. So the protocol, we should have them. They are, but today's Ukrainian protocols, their problem is they don't cover all diseases with which the patient comes to the doctor, and they are not always up to date. Very often they are obsolete. They are to be improved. And the last question, Radio Vesti, it's about paramedical. I talked to the workers of ambulance, and they say that not everywhere we have doctors. For example, I have pain in the heart. When they go by ambulance, they decide to which hospital to take the patient, and they diagnose, and the paramedical will not be able to do that. That's not so. All over the world, paramedic is the bachelor, the person who studied for 3-4 years after the secondary school and is trained to work in the ambulance. It's like super paramedical for ambulance. The level of these paramedicals is higher than the level of our doctors. I mean the quality of education. The requirements are very, very high. Paramedical, it's like in our case is emergency case paramedical. It's like a and another question is, myself as a doctor, when I studied the medical university, I know what should be the voltage of the lamp in the toilet in the hospital. I don't know whether the person knowing that, whether this is a useful knowledge for a person who's in the ambulance. And the ambulance paramedical, they are really like gods of medicine. In some cases, we do need doctors, but even now, our paramedics are taught how to make decisions. So don't worry. Thank you. This is the end. All the best. See you again.